I have not. My knowledge
all you need to know is you can escape out of that one, and then your one will be open. So you just go to your one. Which one's yours there? And then you just start on the first one and just press that and it goes on there.
Are they stored? So when I skip out of here, how do I, oh, I can just highlight this and then find it.
Yeah.
Okay, thank you.
But now I can't see the basic one.
Oh,
There we go.
first one?
No, I'm the second. Well, they don't count.
You can read my notes one more time, okay? Look at my comfort zone, guys.
Okay. So this is what we're doing.
Okay, that's me.
So once, I think we're ready to get started, so.
Well, early if we start now.
Oh, well, I mean, oh, okay. Got that one.
I think it's already, I think someone's automatically done it.
Yeah. You can just do one.
You guys don't have to worry about the recording. We got it.
Okay, that's what we do. So you guys are on it. We don't need to do anything.
Yeah. I know.
Don't worry about
Right.
What do you reckon, Angela? Are we ready? Are we ready? Okay, good morning, everyone. Good morning. Right, so just to check, you're all in the right room. This is the Safe Drinking Water Management in Small Systems. That's what you were all expecting? Great. Awesome. Starting off well on day 2. So welcome everyone. I am Esther Shaler from UNICEF. I work on product innovation, which includes rapid water quality testing. Hence, I have been allowed to start this session this morning and make your days even brighter. So in this session, we're going to be talking about the safe drinking water management in small systems and the implementation of WHO's guidelines, which will be coming out early next year, all being well. I'm pretty excited. They're quite useful for UNICEF, but also for our partners, working with governments, different water providers that UNICEF and a lot of the actors in here are supporting. It's one of many good examples of collaboration between UNICEF, WHO, and other actors in the sector. We mentioned a lot yesterday the state of reports, and I should mention that today in New York, the state of water report is officially being launched. Hence, you have me and not Jorge. Sorry. But there are other cool documents that we've got, such as water, the documents on lead in water, and I think there's some sessions on lead in water later this week, if I'm right. Cholera prevention, and of course, my personal favorite, which will be coming out next year, the field testing guide for water quality that will look at at 6 in total, but we're focusing on professionalization, operation and management of small water supplies, as well as data sharing to inform decision making and action. So the way the session is going to run, we're going to look at the guidelines themselves that you're all very excited about coming out and what you can expect from them, but also these 2 particular recommendations and how we can use them and how they're going to help the sector to do better at providing clean water in small scale systems. We're going to start with some presentations from Angela on the guidelines themselves. And then we're going to have 2 presentations from Lars and Katrina, that way around, on the professionalization of small supplies, and then a discussion, which we hope to hear lots of from you guys. And then lastly, Rachel and Sarah are going to be presenting on the use of data for decision making. So I hope that you're all ready to give your thoughts as well, and there'll be some good discussions. And with that, Angela, all yours.
Thank you, Esther, for the introduction and also for infusing some energy into the start of our session on this Tuesday morning. Ray, if you wanted to come up, Ray from World Vision is going to introduce himself. He's one of the co-conveners for this session, and he's also going to walk us through a Mentimeter poll to get your thoughts on a couple of things related to the session topics to get us all sort of warmed up and engaged. Let's see if we can switch over to the Mentimeter poll. And if you have your mobile device or computers, so you can participate in the poll. Oh, it looks like a few folks have started.
Already started. They're ahead of us.
Okay.
Good morning, everyone. My name is Ray Norman. I serve as the global sector lead for WASH for World Vision International. Just by way of brief background, back in 2020, we signed a cooperation agreement with WHO to support them in reviewing and updating these guidelines. It's been a wonderful journey. We have been providing feedback from a practitioner perspective since we are a major field implementer. I think we've been doing that from between around 10, 12 different countries around the world. We've been providing case studies and course sharing, monitoring data, et cetera, and we are looking forward to participating in the dissemination of these guidelines once they're complete in the near future. So we've got a few questions for you. Some of you have already started. So the first question is, if you're checked in, the first question is regarding small water supplies. Do small water supplies need special regulation and consideration? Need special regulatory consideration. Angela, we can do these one at a time or go through all of them now. Okay, let's keep on going. So if you've had a chance to think about that, well, let's move on. The small water supplies require ongoing external support. And please respond what you really think, not what you think you ought to think or what you think everybody else thinks you ought to think. This is from your perspective, from the niche that you come from. from the perspective that you are in, what do you honestly think? Okay, number 4 is going to be interesting. This one's a little bit tricky.
You're not getting your audio.
Oh, sorry, do I need to stand here? Okay, sorry about that. I thought I was speaking loud enough. So this third one's a little bit tricky here. Do small water supplies or small water supplies are not professionalized? What's your thought? I see a few quizzical looks. I think we'll have a little bit of disagreement here. And then the fourth one, small water supplies are associated with limited data availability. And of course, on some of these, there is no correct answer. So don't get any angst over this. I'm amazed at how anxious people get on it. With these Mentimeters. Okay, is this thing going to do anything else? We're it. Okay. It seems to have slowed down. Everyone's gotten their answers in. So let's look at number 1. Rate the following statements. Small water supplies need special regulatory consideration. We've got 7.4. Looks like the majority of us agree on that. Any quick comments? Any thoughts or disagreements? Good. Okay. Do they require considerable external support? 6.4, I think most of us agree that they do. Small water systems are not professionalized. 4.2. I'm going to leave that for further debate. Okay, I'm sure we'll come back to that eventually. But there's some questions here, and there's ongoing discussions about that. So we'll certainly hear more from them from others later on. Number 4, that they're associated with limited data availability. This would surprise me. We have 7 here. I think that is changing. We're not there yet, but I think most of us agree that they're associated with limited data availability. Okay, good. Well, thank you all for participating. We're going to come back to some of these in our discussions, and when we have Q&A, of course, if you have something to add to this, please do it. So back over to you, Angela.
Thank you, Ray, and thank you everyone for participating in the poll. Some of what I'll be presenting touches on some of these polling questions, so it's interesting to see where everybody sits as a starting point. Okay, so my name is Angela Reinhold, and I'm a member of the water quality team at WHO headquarters. And on behalf of WHO, I really want to thank you all for being here today. I know there's a lot of stiff competition. There's so many great things happening in parallel. At any given time, there's 2 or 3 places I want to be, including right now, if I'm honest. So really appreciate you being here to join us for this session. Esther mentioned during her opening remarks that one objective of the session is just to make you all aware of some forthcoming a forthcoming publication by WHO on small drinking water supplies. So that's what my presentation is about. So I'll share with you a little bit about the document's purpose and scope and content, just at a really high level. And then we will talk at the end. I'll conclude by sharing a couple of the concrete recommendations from the guidelines to set up some discussion around 2 interesting topics. So the forthcoming guidelines for small drinking water supplies link very closely to WHO's main guidelines for drinking water quality, A lot of you will be familiar with this document as the WHO publication that sets out the evidence around safe limits for more than 200 drinking water quality parameters. But these main guidelines for drinking water quality also importantly set out a framework for safe drinking water, which comprises 3 components. The first is establishing health-based regulations and standards that define priority parameters and safe limits. And then the second is water safety planning, encouraging proactive risk planning by drinking water suppliers from the catchment to the consumer. And then the third component is independent surveillance to make sure that water quality and safety are being tested independently. So those are the 3 components of the framework for safe drinking water. And we know that implementing this framework can be challenging in the context of small drinking water supplies. And there are a number of reasons for that. I heard some of them touched on during yesterday's presentations. So some of the challenges that face small drinking water supplies include oftentimes they'll be remote and dispersed, which has real implications for the feasibility of carrying out routine surveillance and monitoring, for visiting the systems to provide technical support and to benefit from economies of scale. The caretakers or operators of these systems may have limited opportunities for the training and the retraining they need to effectively do their jobs. There may be limited equipment available to these supplies for monitoring, for treatment, and then there are often inadequate funds for routine operation and maintenance. So these are just a few of the challenges, but we know that the challenges that face small drinking water supplies are very real. But we also know that we have an important opportunity here to really improve access to safe drinking water for a large proportion of the global population if we work out how to better navigate some of these challenges. So this is the rationale for these new guidelines for drinking water quality that are focused on a particular context of small drinking water supplies. So the aim of these guidelines are to support governments in implementing that framework for safe drinking water that I just shared with you in the particular context of small supplies by providing guidance that is practical and risk-based and that's really rooted in resource realities. So these guidelines take the position that small drinking water supplies, they do face unique challenges, and they do indeed require some special regulatory consideration and also ongoing external support to achieve and sustain safe drinking water service delivery. So based on the Mentimeter poll that Ray led us through, it seems that a lot of you are coming from a similar place, have a similar view on this. Now, these new guidelines for small systems, they're not a new from scratch publication. They're actually an update to an existing WHO publication. It was published in 1997, and it's volume 3 of the guidelines for safe drinking water quality that focuses on the surveillance and control of small drinking water supplies in the context of community managed systems. So some of you, especially some of our WASH veterans, will be familiar with volume 3. A lot of you may not know it, but even those who don't know volume 3, you might be familiar with some of the content, like these sanitary inspection forms were published in this 1997 version of the guidelines or volume of the guidelines. So sanitary inspection forms are those simple yes/no checklists that help to identify whether priority risk factors are present that threaten the safety of drinking water supplies. I'm curious how many of you have seen or used sanitary inspection forms that look something like these? Yeah, quite a lot of you. So part of this update to these guidelines is updating these sanitary inspection forms to reflect literature, global experience with these SI forms over the last 25 years. They've got sort of new and improved, lovely drawings from Rod Shaw, for those of you who know his work. And also importantly, they are bringing in a little bit more components of risk management rather than just being a risk assessment tool. They encourage corrective action based on the risk factors that are identified, taking corrective action, recording corrective action, and they also encourage planning for ongoing monitoring and maintenance. So a little bit more on the risk management side as opposed to just being a risk assessment tool. Also, the updated version of these guidelines, the new guidelines that are coming out next year, have an expanded scope relative to volume 3. So whereas volume 3 focused on the surveillance of small systems, the new guidelines also incorporate guidance on water safety planning and sanitary inspection by operators and caretakers of small supplies for that proactive risk management. And the guidelines also provide guidance on health-based regulations and standards. And then in terms of the type of water supplies that are covered by the guidelines, whereas volume 3 focused on community-based management, the new guidelines have a broader scope in terms of the management models that are covered. So on one end, in the guidelines, there's guidance related to individual wells serving a single household, all the way up to a utility that's serving a small town. So a much wider range of system management models that are covered. Okay, so just to give you a little bit of a teaser of what's inside the guidelines very broadly. Firstly, the guidelines are structured around this framework for safe drinking water, much the way the main guidelines for drinking water quality are structured. So we have guidance on these 3 topics: the health-based targets or regulations, water safety planning, and surveillance. And then for each of these main framework elements, these are the sorts of questions that are addressed in the guidelines. For health-based targets, there's guidance on what parameters should be prioritized for monitoring where resources are particularly constrained. So where can you get the most bang for your buck in terms of public health protection by investing limited resources in monitoring? And then how should monitoring frequencies, minimum recommended frequencies, vary by the type of supply? So we would expect more frequent monitoring for that utility managed system serving a small town relative to the individual well. So there's differentiated guidance within the guidelines for monitoring frequencies according to water supply type and management typology. For water safety planning, there's guidance on how risk management approaches taken by caretakers and operators should vary or might vary according to the size of the system, the population served, and the risk exposed, the capacities of those caretakers and operators. So again, we would expect a more comprehensive and robust risk management approach by that small utility as compared to a community managed system that's run by a couple of volunteers. So there's guidance on kind of how to be realistic and work with people's capacities and abilities, but still provide as much risk management protection as possible. And then what support is needed for effective and sustained implementation of water safety plans by these caretakers and operators. What sort of training and tools and templates and ongoing support do they need to implement and sustain these water safety plans? And then for surveillance, there's guidance on how to target limited human and financial resources to carry out surveillance activities for the greatest public health gain from the investment of those limited resources, thinking about prioritized site selection and surveillance activities that are the most important. So that's just an idea kind of what's in the guidelines. This is our timeline. We are currently working on updating the document based on some peer review comments that were received during a recent round of peer review. There have been a number of rounds, and this we're thinking of as the final round of peer review. So we're making changes. We hope to finalize it by the end of this year and then to publish the document early next year. So keep your eyes peeled. This is coming soon. Okay, so that's the big picture overview of the guidelines. And now I'll drill down to what a couple of the recommendations within the guidelines are to set up some discussion we'll have on 2 of these topics. So one of the recommendations in the guidelines relates to the professionalization of small drinking water supplies. So the guidelines recommend that governments facilitate the progressive improvement toward professionalized operation and management of small drinking water supplies, in particular those community managed systems and certainly the utility managed systems. And then a second recommendation in the guidelines is to really focus on data use. So not just collecting data and generating data through surveillance activities and the like, but using that data in a meaningful way. So strengthening systems of data sharing and use to inform decision-making and improvement action at all levels, from the water supplier level and then subnational and national levels. So those are the 2 topics we'll be discussing today. We'll have a couple of presentations and some time for discussion around each of those topics. But before I hand over, I just want to flag, and then Esther mentioned this, to do Also the state of drinking water report that was discussed during the plenary session yesterday. This report includes these same two recommendations to professionalize drinking water supplies, including small supplies, and also to really focus on the meaningful use of data to drive decisions and to make improvements. And this is being launched today in a couple hours time in New York. And then there's a session on the state of drinking water report on Thursday morning, if anybody would like to join that session. So with that, I will hand over to Joe Brown, who is going to introduce the first discussion topic, which will be the professionalization of small supplies. So thank you, Joe.
Thanks, Angela. Hello, good morning, everybody. Hope you've had your coffee. It is really great to be here. My name is Joe Brown. I'm a professor at UNC Chapel Hill. So welcome again to everybody for joining us here in Chapel Hill. I hope it's a great conference. It's really great to see the interest in professionalization and in this entire topic. This was, I don't know if you were here last year, but one of our main plenaries was entitled "The End of DIY Wash," which was not meant to necessarily be overly critical in the way things are, but I think reflects a growing sentiment that professionalization of services is part and parcel of creating sustainable systems that we can all build on. So our first topic here today that we're going to discuss is professionalization. I should also say I've worked on small water supplies in a few places around the world, in Cambodia, India, Vietnam, but I'm also increasingly working on these small systems in the United States, in rural areas. I probably don't need to tell this crowd, but there's some commonalities across small systems, right, that really have brought this community toward this idea of professionalization. I mean, the vast majority of systems are small systems around the world. This is a sector that's where a lot of the gains that are happening in pipe drinking water connections and extension of services are happening in the small system space. In the United States, we have 60,000 community water supplies. 93% of them serve fewer than 10,000 people, and about 2/3 serve fewer than 500 people. And where we've looked at health-based violations for our community water supplies in the United States, the overwhelming majority of the burden is on these small systems, right? These are also systems that are under-resourced often, systems that might be facing aging infrastructure. I work in a place in Alabama where all the pipes were installed 40 years ago, and they had a 25 to 30-year design life, and they're all falling apart right now. And the average age of the operators in the place that I work is like 68 years old. So, these are some commonalities, right? These are also systems that often serve rural disadvantaged populations. So you have this sort of, co-occurrence of less resources, but also higher burden. So, so it's great to convene this group around trying to develop some ideas and understanding around this. I would also say this word professionalization scares some people. So that doesn't mean that we're going to take everybody who's currently trying to solve these problems and exclude them from the new path toward developing pipelines of trained people who are well equipped to do this job, but really requires us to think broadly about what professionalization even means, right? So I want to invite Lars to come up. Lars Osterwalder is from the IRC. He's an environmental engineer. He's been working in East Africa. And he's going to describe a bit about professionalization in water supplies in Ethiopia. And then we'll have a bit of a discussion after that. So you're very welcome, Lars.
Good morning, everyone. Thanks a lot to the organizers of this side event to invite IRC Ethiopia to make a presentation about an assessment we did a couple of years back in Ethiopia. It's rather to set the scene about what we would think is important in terms of professionalization. We did a study on behalf of UNICEF, and in the technical paper for UNICEF that came out of it, one of the conclusions was that investing into the professionalization of service providers is recommended, particularly for multi-village water schemes. So If I talk about multi-village water schemes over the next few minutes, I talk about small piped water schemes serving several villages. Just a little background. We did sustainability checks on behalf of UNICEF, including rural water, rural sanitation, and institutional wash. Right now, today, I will only talk about rural water. The assessment was at district level. We looked at the district. So my results, the results I present, don't necessarily look at the UNICEF schemes or UNICEF water supply or supported supply directly. It was done a few years back in 2018 during the rainy season, in 2019 during the dry season, and it was implemented by IRC and by a local engineering company, Hiwas Engineering Consultants. So how did this survey or the sustainability check framework look like? First, we looked at the service level. What is the quality of services provided? Like, what do people get? But we also looked at the conditions for sustainable service provision. What does it mean? Yeah, that includes the service provider level. Here we are looking at indicators of the water committees, our rural utilities, and about the service authority level, that's district level, regional government overseeing water supply. I don't talk about this last part, about the service authority level. Here, just for some people in here, I'm sure, who know Ethiopia. So it was all over the country. It was selected, the Woredas or the districts were selected by UNICEF. So it's not completely random. But at the end, we visited 15 out of the selected 16 Woredas. One, for security reasons, we couldn't implement the survey at the end, unfortunately. So when I talk now about multi-village water schemes, what does it mean? And we basically went into the Woredas and wanted to visit as many of those piped schemes as possible. Some of the Woredas didn't have any, others had a bit more than 5. So in a few places, we didn't visit all, but altogether, it's basically all piped water systems in rural areas in those districts. Just to give you a bit of a sense, so some of them were relatively small, maybe just 5 public standpipes, others were a bit bigger, and all of them serving between 150 and 3,000 households. Important, all of them we found were managed by volunteer water committees. Yeah, there was already some progress at that time to professionalize those schemes, to have rural utilities, but we didn't find that to be in reality yet in those 15 Woredas. This slide, please don't get scared. You don't need to understand the whole table. Just focus on the orange box. I notice it's at the bottom, maybe not be the best place to be. But here we look at the service providers indicators. We look at community management indicators to understand how well is the water committee organized. And we compared the multi-village water schemes with other point sources, like that can be shallow wells or protected springs. So what we found is that the wash costs for the multi-village water schemes were indeed stronger than the water committees for other type of water sources or water supplies, which is good. They scored the highest, so we should be excited about that. However, when we used another set of indicators and we applied the rural utility benchmarks, they didn't do very well. Like there was a lack of staff, a lack of capacity, no data about water production and water sales. So we couldn't establish non-revenue water or anything. So it's almost no data available, and no surprise that when we looked at the service levels and the reliability, just as an example here, that the multi-village water schemes, so the piped schemes in rural areas, were less reliable than a simple hand pump or much easier systems that we found there. Just as an example, we talked to users of those water schemes. Only in 26% of the piped schemes, the majority or 90% of the people said that almost always or always when they go to the water point, they will find water. Yeah, so that was significantly lower than for kind of simpler systems managed by community, by the WASH committees. When we look at water quality, like we would also have hoped to have better management, better water quality at the multi-village water schemes, the piped schemes. Not really. I mean, users reported that they are a bit more excited. They perceive the water quality to be better taste, better aesthetics, but microbiological quality was bad on both piped schemes and all the others like shallow wells, boreholes. So to conclude, or the points we then delivered to UNICEF in Ethiopia was that we believe that multi-village water schemes should not be managed by volunteer water committees. And I mean, UNICEF agreed, and there was already process ongoing to change that. We think management of water supply systems should be done by paid water professionals. And we think, or we recommend that national policies should be formalized. There should be a regulatory body to oversee tariffs and performance of such schemes. So that's fortunately ongoing. There is now a guideline in place. The government recognizes that piped schemes should be managed by utilities and not necessarily by water committees. We would like to see business plans based on diagnostic assessments and on a joint vision. That's also something IRC is now working with UNICEF in certain utilities to strengthen them to understand how much money they can make and how they can operate their systems in a better way. We want to see asset management. We want to have reliable tracking of water production and water sales, and of course, management of water treatment and water quality. So just for setting the scene that in the context of Ethiopia, especially for piped schemes in rural areas, we wish to see professional operation and more capacity for doing so. With that, thanks a lot.
Thanks, Lars. We're going to have a Q&A for both of our speakers after the next presentation. So I'd like to now invite Professor Katrina Charles to come up and speak. Dr. Charles is a professor of environmental health risks at the University of Oxford, has been studying professionalization in Kenya and Bangladesh for some time, is one of the leading lights around professionalization in the world. So she's here today to talk about the professionalization of services in Bangladesh, and is also representing the Rural Water Supply Network with whom she works very closely. So please, the floor is yours.
Thanks very much, Joe. Okay. Right, so yes, I'm going to share some of our work from Bangladesh. This is a case study where we have implemented a professionalized service. It's called the Safe Pani program, and that's in partnership with the government of Bangladesh. So this is starting to address some of these issues that have been raised already about how do you get skilled people to run your services, and particularly how do you get them to run it with them in mind of thinking about water safety. So it's not just about reliability, that's a very core part of any professionalization, but also how do you ensure the safety of the water. So this work is part of the REACH program, and so we've been working for a number of years with Fundifix in Kenya, and that's one where they have a professionalized service program, which is working in community water points, schools and healthcare facilities, and which was established in 2014, but since then we've been working on also advancing water safety with them, and that's been work that Saskia Novitsky's been doing. And so we've been able to use our learning from that as we implement Safe Pani in Bangladesh. So Safe Pani was established in 2021, so less than a year ago. It's providing in the first phase, we started providing professionalized services for 78 water points, a mix of water points. So it was all types of water points within the types of institutions we were working with in 4 unions in coastal Bangladesh. And so that focused on schools and healthcare facilities, but also 3 piped water schemes in rural areas as well. And we had water safety integrated from the start with a water safety planning approach to that. So and I said that's the first phase. We've already doubled the number of water points that are being included in this, and we're looking to scale up to district level. So the need for professionalized services in Bangladesh and professionalized services that address water quality is huge. So while the population almost universally has access to improved drinking water sources, those services are usually decentralized. They're smaller systems, they're predominantly tube wells, and so you can see piped water services are quite low. As well, many of you will know Bangladesh has significant water quality challenges. So there's E. coli, which is the, I think I have which is that the graph there is just highlighting data from the mix report showing the number of supplies that have E. coli present. We've got arsenic is another major challenge that needs to be considered and managed. The other 2 are manganese. So that's one that is increasingly recognized as an issue. And then salinity is a growing issue in coastal areas as well. So you've got all these water quality issues to manage. And so it's quite complex to make decisions about how you improve water safety. The other issue you have is about whose responsibility is it to do the operation and maintenance. So currently in Bangladesh, the Department of Public Health Engineering is responsible for installation, but not for operation and maintenance for many systems. But they do, so for in schools and healthcare facilities, it's down to the people working in those schools and healthcare facilities to do that operation and maintenance, including the water quality management. And so then you have this issue that you have people who are not trained for it, but also don't have the time in their jobs, don't have access to that knowledge to do that job. So the way Safe Pani has been implemented has been based on work with the government. So on the diagram on the left-hand side is from the Mixed Water Quality Report from last year. And so Bangladesh is thinking about how do you use their expertise, their capacity in laboratories to shift from what's been a nationally representative sampling approach as part of MIX to one that is embedded in their labs and actually provides data, not just for those national level advocacy and policy processes, but straight back to water managers as well, so they can act on this data. So Safe Pani has then been set up with this in mind and with a water safety planning approach in mind. So at the core, we have a service provider, Haisawa, who's an NGO who've got a lot of experience in this area. And so their work role is to provide operation and maintenance, including water safety. And some of the key parts of this is they have an agreed remit for repairs, for low cost repairs, and for improvements to the system. And they have a remit for doing sanitary inspections and water quality monitoring. So their role in terms of the water safety plan is very much to provide that risk identification, risk characterization for different systems. But then they also have a number of controls that they can put in place that's agreed. So there are some rapid responses to water quality risks that they do. And I'm going to go into that more in the next slide. One of the key things they do is they report data to the government. They report data to the Department of Public Health Engineering directly, but as well as to our steering committee. So the steering committee is made up of all the interested parties. So the Department of Public Health Engineering, who have responsibility for installation. We've got the ministries from schools and healthcare facilities who then are working with their teams in terms of and responsible for providing safe services in their facilities, as well as the more local areas of government, academics, and UNICEF as well. So they are all there because they control all those different finance pathways that are supposed to help these systems to not only operate but operate safely, and to operate in a climate resilience manner as well, because it also includes those with funding related to disaster risk. And then, so within the water safety plan, as I said, the service provider does some immediate actions, but it's the steering committee who has access to those finances, who are prioritizing those risks, thinking about the prioritization and decisions on investments. So when you have a system which has manganese and salinity issues, it's the steering committee then who have the decision about how do we prioritize that, who's going to pay for this, and what's going to be that action. We have, so the results quickly, in the first few months of operation, as I said, we had 79 water systems. They were all tested. I'm focusing on E. coli. They have as many as possible been tested for arsenic and manganese and chloride as well, and those are working with government labs. But there's a lab within Safe Pani that does the E. coli testing. So of those systems, 59% had no E. coli, but 41% had E. coli detected. And so straight away, because we had these agreements, the service provider could go out and report that to the manager. They shock chlorinated, they retested the systems, and all of them have been confirmed with no E. coli following, a few days following that. And those actions are happening within 80% within 3 days, and we've got 100% within a week now. So you're getting very rapid changes. We've also got improvements in the sanitary risk scores as well. So sanitary inspections are a tool that's being used. So initially you had about 50% of systems with low risk sanitary inspections, and we're up to 90%. They've been able to do actions like cleaning out rainwater catchments, improving plinths, and they've managed to make a real difference. So overall, these improvements to water services have been, with these systems, we're making improvements that are benefiting approximately 15,000 staff and pupils and patients at health schools and healthcare facilities, plus 10,000 community members who use the pipe schemes. That's 25,000 people. So is this still a small system, or should we be thinking about this differently now? When we, and the cost of this, if we think about the cost, we estimate if we were scaling up, it would be less than $1 per pupil per year to do all the schools in the district. And of that, water quality is about 20% of those costs. So it's not as significant as often considered. So just to summarize, I think professional service providers there's big opportunities in terms of specialization, making sure there's skilled people to deliver this work. There's opportunities for accountability. Certainly we're working closely with government, making sure that data goes back to the government and they can see what's happening. And for bringing in financing in different ways as well, because it's much easier to finance a service provider than trying to distribute finances to all those individual water points. The limitations, there is challenges in terms of the laws and policy in different countries, and we can talk about that later potentially. But one of the key things we found from the Fundifix example was the difficulty in retrofitting water quality into these agreements. If you have already set up your agreements with your service providers, and the users know this and the government knows this, you have to change that completely when you bring in water quality. You're changing your purpose. And so it really is easier to do it from the start, which is what we found with Safe Pani. So thanks very much. We have a couple more sessions throughout the week that may be of interest. We've got passive chlorination and some of the work that's been done with Fundifix on Friday, and Andrew Armstrong, who works with Uptime, who are a consortium who work on professionalized services, is speaking on Thursday as well. Thank you.
Thanks, Katrina. And Lars, if you want to join Katrina up here. So interesting presentations around Ethiopia and Bangladesh, and maybe places where professionalization is probably warranted and a compelling model for professionalization. We're going to open up questions to the room now. So Q&A, I don't know, is this being live streamed? So you have to go to the microphone, I'm afraid, if you have a question, so you can queue back there. I can start out. you used the F word a few times, Katrina, financing. And so I guess the thing I'm wondering about for the Bangladesh and Safe Pani is like, how big of a departure is this program from the way things usually are run in Bangladesh? And what are the sort of requirements and considerations around financing? I mean, is this costing a lot more money, and where's the money coming from? I guess is the simplest way to put it.
I see some autonomy if this isn't working, this microphone.
Oh,
It doesn't sound like it is. Okay. So, I mean, the key points are initially in this first phase, the REACH program has been funding these first two phases, and we're looking for financing to take it up to scale to support that. But one of the key things has been looking across the government at the different mechanisms for financing these. I mean, these are there. There are budget lines by which schools are supposed to finance operation and maintenance of their water systems. But then it isn't necessarily a way of tracking that, and and the schools don't have the skills to even understand they have that finance, let alone use it and work out when to prioritize it. So I think this is it's a big shift in that way, and making sure that those finances are effectively put towards these purposes. And it also helps to manage that distribution of risks and responsibilities. And not all schools have the same needs in terms of that budget, but they'll all be given the same budget unless they have more information to inform that. So having this information gives you a better way to prioritize those who are most at risk and who need support to have better water services.
any comments on pathways to financing in Ethiopia that you want to offer, Lars?
I'm generally in Ethiopia, and I guess it's in many places. It's like rural communities pay a lot for water. Like people pay per jerry can. And if you add up what people pay per cubic meter of water, it's, I think, 10 times what I pay in Addis. So there is, it's small quantities, but there is a significant amount of money going into water. And it's quite broadly known throughout the country that you pay for water. That's, I think, a good thing in Ethiopia. People recognize in most places that water comes at the cost. So overall, we would hope to make the case and see that the potential revenue is high enough to at least finance operation and maintenance, if not for capital maintenance at the end, to make kind of a more compelling case also for more investments coming in, ideally from other sources than just government and NGOs. So yeah, there is some money.
There's money
some
there.
revenue that can be generated, and we would hope to see that.
To make that case, yeah. Other questions from the room, please? The microphone is open.
Thanks for the presentations. Karen Steady from Acquia. We're working on the Rural Evidence and Learning Program for water, sponsored by USAID. And we started out with one of our 3 research streams being called professionalization. And through some of the year 1 desk review activity, realized there wasn't a great common definition, and have kind of moved away from that towards saying management practices. And right now, I think we're looking at on the order of 29 different management practices to kind of define that. So I was wondering, are there 4 elements that you're seeing, kind of key elements of professionalization? That's part 1. And then part 2 is I'm also wondering, is operator certification and the ability to kind of turn over operators who might not be performing well part of the answer to that?
Okay, so I think for us, the key elements of that professionalization are that you have people who are responsible and accountable and are paid to do that work. So that when the repairs are done by someone who, as you pointed out in your presentation, Lars, that you have people are paid, and so there is a mechanism there very much that if they're not performing, that is a job, and they should be, they are accountable to someone. And so a lot of the work of the uptime consortium has been look at those accountability mechanisms. So those at the moment are very well established for results-based funding for operation and maintenance, and we're working further on water safety ones of how do you bring in water safety into that framework of accountability as well.
I'm afraid I don't have much more to add. I mean, just to highlight like that volunteer water committees are re-elected usually I think every 2 years or so. So every 2 years you have new people, new volunteers coming up and then responsible for managing a system. So like to see more consistent, more qualified, more skilled people to manage the system. And probably in addition to water safety, would also be more professionalized in terms of finance, like professionalized payment collection and kind of a more strategic investment of the finance of the revenue on improving the system.
Other questions in the room, please don't be shy. So I think a lot about human capacity. I know the places I work in the United States, I mentioned it that, you know, the mean age of operators is in the 60s in some of the places where I work. Sometimes the operators running systems are also running the town backhoe and in charge of many other things. Sometimes they don't have a computer. And I know in this country, in the water sector, we talk a lot about the professional development and sort of supply chain of interested, motivated, well-trained, equipped people entering the workforce that are going to, you know, become the next generation of operators for water supplies. And so I'm wondering maybe if you could address the human capacity side in both of your settings, like are there gaps there? Are there challenges, or is it just a matter of organization and sort of centralization and speaking a common language around training? What is the training? What's the pipeline for these people look like for people who are going to be involved in these sectors? It's a big question, sorry.
It is a big question. And because I think one of the points it comes back to is the water safety planning, you know, the approach is that it's incremental improvements, so that the training, you don't need everything to be in place at the start, but it's how do you get that progress happening. And that's very much how we've been working with Safe Fanny, of trying to make sure that we're looking at what's achievable now, and then looking at how we can improve stuff. So where in Bangladesh, capacity generally is quite easy within the professionalized service model, that we've got people who've got degrees in water quality. We've got, you know, plenty of capacity in all those areas. There are still challenges, but it's much easier to manage than challenges of trying to do it remotely and have that training for every school teacher to know how to manage their water system when there's so many different water systems that are also being used in those areas. So I think that's it's very important to think about those human capacity ones, but I also think it's less of a barrier when you get to that scale.
In the case of Ethiopia, I would say capacity gaps is a big challenge. Like to find qualified people who are also willing to work out in the countryside is not that easy. But what we do at IRC, I mean, we have our WASH Systems Academy, kind of one approach, online free training available. We try to get that into curriculums at universities and the technical vocational training centers as a way. Working also with blended learning. That means gathering people in a room, everyone on a laptop going through the online course, but then having reflections in group discussions to make sure everyone really gets and understands the content. Of course, also translation. So the course is now available in Amharic. I think soon we'll also have it in Oromifa and I think Somali, if I'm not mistaken. So having ways to do influence that the curriculums at universities reach more people, what we would try to do there.
I guess I keep coming back to this question of professionalization. When I think about professionalization, I think about professionals, you know, I think about careers, right? People who want to make this a job and providing jobs for people that provide a living wage. And that means financing, that means organization. So I hope that all of you can grapple with that question and many others in the next session, because I've got to leave and I'm going to hand this over to Jan Willem, who's going to hopefully answer all of the questions about how we make professionalization a reality. I'd like to thank all of you for this session and invite Jan Willem to please come to the podium. Jan Willem Rosenboom is known to many of you as the shortest man at the conference. And he's with the Bill and Melinda Gates Foundation. It's been a great pleasure to work with him over the years. So Jan Willem. Thanks, Joe. Do you want this? This is
No, I think I'm okay. Being the shortest man at the conference, I always struggle with these microphones. I look like Godzilla making a dive. If you want to talk more about professionalization and capacity development, then you should come to the plenary session after this one, because this, the remainder of this session, we'll talk about data. And as Joe said, I work for the Gates Foundation, and anybody who knows what the Gates Foundation does in WASH knows we work on sanitation. And I'm here to reassure you that in a previous life, I also worked on water, including small community supplies in Sierra Leone and Kenya. So I'm really excited to hear that the guidelines for small community supplies are coming out soon. Full disclosure, I had a sneak preview of the document and I loved it. I think you're going to love it too. You should really get it when it comes out. I know that, Angela, that you showed in your slideshow the second edition of volume 3. And I'm wondering whether that first edition I have at home is now worth any money now that we're upgrading. But so I really recommend you to take this. And what we'll do for the remainder of this session is listen to 2 other presentations that look at the data component, the data for decision making. And if you were at the plenary yesterday, you heard Clarissa talk about the SDG acceleration framework for water supply and sanitation services. And there are 5 accelerators, policy, finance, data, capacity development, and innovation. And data is one of these forgotten accelerators, like policy and finance gets a lot of airtime, data not always. And when we talk about data for decision making, we're not talking about this stuff for mix reporting up or for JMP on sort of global data reporting on progress. As Katrina already mentioned, we're looking at local use. We're looking at water supply and sanitation service providers as public providers. We're looking at public services, so you focus on service providers, on regulators, on financing institutions, and they're supported by the private sector. They're supported by the public sector, but we're not talking about NGO projects or World Bank projects that are being implemented. We're talking about the providers being able to collect data and use it to solve problems, to make decisions, to communicate across agencies. And why is this important? The way we look at it, all improvement is local. Services can't improve without having access and being able to make informed plans, without clear idea about, as Lars mentioned, I think, non-revenue water, financing, planning. And those are some of the things we will hear a little bit about. Before I ask our presenters to come up and present, I wanted to ask Angela whether you had a great example from Bhutan that gives sort of a positive sense. So you want to take a minute and share that with us?
Yeah, thank you, Jan Willem. So I just wanted to share with you an experience that I had in Bhutan to kind of help set the stage for this discussion around data use, because there was a real missed opportunity. in Bhutan. So in 2018, I was part of an assessment, a national assessment of drinking water quality surveillance practice in Bhutan. So I went alongside with the Royal Center for Disease Control, RCDC, in Bhutan to sites right across the country to determine how surveillance practice was going. At one of these field sites, it was a district hospital, and we worked with the staff there that were responsible for carrying out the routine monitoring of the drinking water quality system locally. So they did monthly sampling and testing. And what we found at this site and at sites right across the country, so many great things were happening. We had well-trained staff, calibrated equipment. They were diligently carrying out the monitoring at the number of sites they were supposed to, at the frequency they were supposed to. They had a fantastic data management system that was developed in-house by RCDC, and it allowed data trends to be analyzed and data to be shared right across the country. So much was happening. And when we were at this field site, they were showing us all the bells and whistles of their data management system. And so we were looking at the recent sampling results, and we found that there was no chlorine in the system right through this piped network. And we said, that's interesting. Let's look at the previous month and the previous month and the previous month. And so we looked at data from the whole of 2018, and chlorine hadn't been detected in the system at all. And then we looked at the E. coli monitoring results, and we found that E. coli detections were the case more often than not right through the year. So then we walked the short distance, it was about 100 yards to the treatment plant there in this small town. And we talked to the operator, who readily told us that he'd run out of testing reagents at the beginning of the year, chlorine testing reagents. So he wasn't able to test for chlorine. So for fear of overdosing, he just scaled his chlorine dosing right back, and essentially hadn't been dosing chlorine. So we had so many components in place to monitor water quality. These results were there, they were in the system. So the question was, why didn't a year's worth of water quality results indicating there was a real issue, why didn't it trigger any investigation and any corrective action? So what colleagues in Bhutan determined, there were two kind of elements at play. One was an issue of authority. So the surveillance agency didn't have the authority to require the water supplier to take action. So there was sort of just a real mentality of data collection and not necessarily corrective action as a result of it. And then the other issue was that it was really just kind of the mindset around critically looking at data and thinking of it as a tool to make improvement. There was sort of a culture of data reporting and diligent, collection and reporting, but not a culture of improvement based on the information collected. So that's one thing Bhutan is really working on now, is when they think about their surveillance program improvement, it's not just about collecting more information, it's about making really good use of the data they are collecting to drive improvement. So thank you.
Thank you. I think that's a great starting point. And it's also nice to recognize, data and information are not the same thing. And I would like now to invite Rachel Pellets to come forward and give us a presentation. Rachel is the Executive Director of Acquia, which is a non-profit research and implementation organization focusing on water supply and sanitation. And if I understand it correctly, you are currently leading the USAID-funded REAL project, the Rural Evidence and Learning for Water project, which is not the same as the REACH project that Katrina is working on. Where would we be without our acronyms in the sector? You are doing a presentation on water quality testing results actually triggering that step to chlorination, right? So the floor is all yours. Thank you.
Thanks. Now I'll have to move the mic down here. Let me just get my presentation. Great, thanks. Yeah, great to be here. Thanks so much to the organizers and for all of you attending here in person and online. So yeah, as Jan Willem said, today I'm going to talk about this translating water quality data into action, into chlorination, and a case study that we have from Ghana. And before I begin, I also want to say this is primarily the work of my wonderful colleagues in Ghana, Bashir Yachori and Daniel Kwa. So I want to acknowledge them up front and say thank you to them, even though they couldn't be here today. So a lot of us in this room are data enthusiasts, and we like spreadsheets and peer-reviewed publications. But for a lot of people, that doesn't make a lot of sense, or, how do we interpret that? And even us in our busy lives, sometimes if we get this data in this format, we don't have the time to dig into it and really understand what it means. So how do we actually get it into something that's meaningful? How do we get that raw data into information and insights that are meaningful? So I'm going to talk to you today about water quality data generation through the Water Quality Assurance Fund that Akwaya has been implementing in Asutifi North, Ghana since March 2020. For those of you that did attend our side session yesterday morning, we did discuss this in more detail. And so for this presentation, I'm going to be relatively brief. But basically, this is a model that is an agreement between the National Lab, Ghana Water Company Limited, GWCL, and the government, the district assemblies, and the Akwaya Institute to ensure that the resources are in place for sustainable testing. And through this program, water quality has been tested for the last few years. And the district assembly is responsible for ensuring that the systems are being tested. And through this scheme, we're looking at small pipe systems and also mechanized boreholes and hand pumps. And as you may, this is an old slide, sorry, but I meant to update it. But anyway, this is fine. What this will show you is overall, most of the water quality samples are contaminated. The update that I had was just more data, because I know this is very small data sample size, but it gives you a sense of, this is just from one of the first rounds of data collection, that over, around 70% of the samples had E. coli contamination. So thanks to my colleagues, Daniel and Bashiru, we did a lot of engagement and dissemination of testing results. So these are some of the pictures from the different activities. Monthly meetings to debrief the results to the district assembly, the water and sanitation management teams. Radio discussions, our colleague Bashiru is known throughout this area as a radio regular. So, that's kind of fun, but because we found that's a great way to disseminate information, particularly when people are not able to read. And in Ghana, there's also many different languages. Town hall meetings with leaders here on the left, traditional leaders and youth as well, district assembly presentations, community forums, and as part of this, supplying Aquatabs to kiosk vendors. But I don't want to, I feel like I cannot emphasize enough how much effort goes into these dissemination activities. Really, this is monthly and even weekly engagement that's happening with different groups. And it's really, so what happened with all of these different dissemination events is month after month, people were seeing results that the water was contaminated. And it was really the youth and the traditional leaders and the assembly members that really got upset about this and said, okay, we're seeing results are contaminated, nothing's happening. What's going on? Can't we get some action here? And that really led to traction to inspire chlorination of the small pipe systems. So just to kind of trigger in order, or to go through in order how this triggering actually happened, we did the water quality testing that led to dissemination engagement, the district assembly's request for chlorination in 2 pipe systems. And then they requested Akwaya to provide technical assistance to install chlorination. So we installed the water mission inline chlorinator in one situation. In the other situation we actually were piloting tablet dosing. So we did a lot of work to get the dosing right, but that ended up being very effective as well. And so 97% of samples had detectable chlorine after 3 months. And really this has led to improved public trust and increased revenue generation at the pipe systems, because people are more likely to pay their water bills if they know that the water is safe. And again, we're still doing those monthly and regular meetings and radio commercials too as well, to get the data disseminated to the public. Going back to my initial slide, how do we get from this spreadsheet of raw data into actual action? Some of the key elements that made this happen are trust. We have these existing relationships with the stakeholders in the communities and at the local government, intentional communication, and then perseverance. As I said, it's kind of repeated visits, repeated different avenues for communication, radio meetings, community forums as well. So with that, I'm going to say thank you. I also want to say this was funded by the Hilton Foundation, so I want to thank them as well. And I also want to thank my colleague Anna Murray for helping put the slides together for this. So she's here today. And then I do also want to mention we have a session on Friday morning on water safety management and financial innovations that builds upon this work as well. So with that, thank you very much.
Thanks, Rachel. That was great to kick us off. And for our second and final presentation of this session, I would like to introduce you to Sarah Marks, who is a research scientist at EOWAG, and will share with us some examples of best practices and enablers for the data question on small supplies. Sarah, all yours.
I have to make it even lower. Okay. So happy to be a part of this session. It's been a real pleasure to be engaged a bit with the small community water supplies, also meeting many people through that process. I think the message I'm gathering so far on the presentations just given are that data collection to use is really a story about the people behind the data. So what I hope to do here is highlight some of the main barriers and the enablers. A lot of these were mentioned through the case studies, bringing in also some of our experiences from work in Nepal. And also to acknowledge our partners, Madam Bata and Balmukunda Kunwar, who also couldn't make it, in part because of visa issues. Sital Uprati's in the room. All of these folks have been hugely supportive. The REACH project has been collaborating with us for some time on this project. And to really set the scene, I think it helps to understand that data collection and data use begins with data flow. And what I mean by data flow is, at least in our case, we have these separate nodes, or you can say actors involved, from the testing site, the testers located at the testing site, and collectors who are really in the community on the ground performing the sampling protocol. Each instance of data collection comes with data transfers. So in the case of a single lab for our project in Nepal, the collectors are operating separately from the labs. There's several data collectors linked to a single lab. And the question came up yesterday. If you went to the morning session yesterday, this will look repetitive. Sorry for that. But the small arrows here, we really scale that to be within the holding time for the samples. So that's often about 6 hours. And replicate this model times. So a lab in 5 different districts affiliated, each district having roughly 3 to 5 water supply systems. So if you can envision that, we have a sampler in each community delivering to a central fit for purpose laboratory. Then there is an additional data transfer, a big one, in fact, regularly with these paper and pen logbooks really being transcribed into Kobo Toolbox. And then that data transfer happening at the regional hub, in this case, Helvetis IWRM program offices in Sorquette, but also closely linked to the Ministry of Water and Environment and public health surveillance processes happening at national level. So the district lab is communicating with this regional hub. The regional hub is then communicating a step further to national level. So I struggled to think, should I highlight the good side, the enabler, or begin with the barrier? And I liked, Angela, how you highlighted the Bhutan case, thinking about what actually went wrong. So I decided to highlight first some of the barriers that we encountered. This project's been ongoing for about 6 years, so we've had plenty of time to iterate through and really improve the data flow from collection and then ultimately to decision. The first is disconnect between data collection and user needs. So what this basically means, I think Rachel highlighted it really nicely, where you have a lovely spreadsheet, the data is there, it's complete, but often there is not a step forward in doing something about it. And why can that happen? In the Bhutan case, an authority issue standing in the way. What we've found, we've had similar experiences with data being on various hard drives in logbooks, but not really being put into action. And we found that improvements followed when we took steps to improve the clarity of the data being collected. So clarity and accessibility really means just simplifying our processes, designing indicators, choosing indicators that meet our purpose, say presence absence for initial assessment, which is very simple to interpret, and then moving into counts if needed, if a problem is identified. Institutional cooperation means that in this setting, you can see the homes are quite spaced out. It can be hard to staff a laboratory. It's actually impossible to staff a laboratory full-time on just water quality aspects. So cooperating with the local health institution, clinics, we even have a laboratory situated within a school, and we've linked that to some science classes taking place with secondary students. So that's been a nice step towards harmonization of ongoing efforts that really align. There's also database harmonization. So really understanding how our Kobo Toolbox surveys, and then ultimately the data being housed online, how can these databases be seamlessly taken up or even directly integrated with, say, the health clinics surveillance of outbreaks. So there's many online resources for this. I mentioned Kobo Toolbox. MWater has a very nice free platform for aggregating data and doing some basic analyses. I know it was mentioned as well, staff turnover. So in our case, many of the technicians are quite young, and they're using this technician role as a stepping stone to something else. I think this is a normal situation in many places. Even for myself, I was a water quality technician in a wastewater treatment plant, and I always knew it would be a couple years job and then moving on to the next thing. So acknowledging this reality that people may not be in the role for more than a year or two, we find that we have to get ahead of this a bit, both through cooperation with local institutions. I mentioned the school example, the teacher who's on site has been there for many, many years. So he serves as a sort of a touchstone for any new technician that might be working, and then can sort of keep continuity across the protocol. Ongoing support and training, we aim for twice annual regular repetition training of the protocols and the sampling processes, If we can invite people more broadly to these trainings, it just expands the technical capacity. If someone steps out, let's say for a quarter, another person can step into the sampling role. So that relates to division and replication of the tasks, the skill base for the task. And I think one of the most important factors for us is the bottom one on career building opportunities. So really acknowledging that people are there for a purpose. They don't want to just, of course, a paycheck is important. And of course, you're there to have a job, but it's also a broader vision about career development, maybe moving into higher education on microbial science. So getting to know your staff, linking staff to ongoing projects at the research institution, providing mentorship opportunities have all developed trust and developed more of an organizational culture around learning. All right, so I believe this is the third barrier to highlight: low confidence in data quality and reliability. So it comes up often that, okay, we have all this E. coli data, but you know, the reason it really is high this week is it rained, and tomorrow it's not going to rain, so the water will be fine. We have to increase the confidence in the data at hand, move towards evidence-based decision-making, really by fostering scientific thinking. And that takes time. It's not so easy to do. But quality assurance, quality control processes really bring the technician and other staff into this decision-making process. How did the blanks look today? If there was a problem, okay, how can we conservatively, do we throw the data away from the day, or should we take a look at our process and interpret the results at hand carefully? What I mean by conservative interpretation is relying on risk frameworks and understanding that if a end of pipe sample today is clean, that means that, okay, we have a piece of information, but not conclusive about what's happening tomorrow. So really looking at trends and understanding conservative risk reduction steps is a help in that direction. Triangulation is also really important. I know the guidelines will push even more action in this direction towards linking sanitary inspection forms, as well as the management recommendations to follow with water sampling results. So we know there's not perfect correlation between those two data sets, but together they can really inform a risk reduction approach. And I think they're quite powerful for learning as well. The last barrier, I think it was mentioned nicely in the plenary yesterday that it was Mohammed Ba who said, decisions are often taken based on assumptions or on what your friends say you should do, but we must move towards a culture of evidence-based decision-making. It takes time to address the habit of making decisions in a certain way, but fostering a culture of data use. I had mentioned student projects. I think they go a long way. If you bring in a master's student who can make use of the data to sort of construct an action-oriented research project, their engagement on that thesis can feed back into the data users and the operators, also adopting a very evidence-based scientific mindset. Data transparency, it's hard to do if data is sitting in a paper logbook. To really be transparent with those data, it's just a lot of information. So really moving towards these online platforms, making them accessible at the organizational level, I think encourage more exchange and critical thinking around the action steps to follow. And maybe the last element that we've learned as researchers, you know, we like to collect data on everything and really ever expand more sampling, but keeping it simple goes a very long way. Even for fostering student projects, you can get a lot of information out of a relatively simple protocol. So with that, I have not covered all barriers or all enablers, but I hope it encourages some thinking and we can move into discussion.
If I were to wear my sanitation hat, I'd be like, this is a little bit the same as putting the seat up and down, you know, when we do this. But Rachel, you want to join us at the table? We only have 5 minutes left for some questions. I promise to get you out of here in time for your coffee break. But I wanted to thank both of you very much for these presentations. And the mic is open. We're still being live streamed. So if you have a question, please come up to the microphone to ask it. While you're all thinking of your questions, a starter question for me, it struck me in your presentations that both in Ghana and in Nepal, you managed to overcome some of these barriers that we see to data use and really get to what it takes to do that. You had some great pointers. If you were to summarize some of the things to people in the room who say they want to make progress, what are some of the things you told us what to do? What are some things you learned to avoid that can help them get there faster?
I'll start maybe, and then Sarah, feel free to jump in. One thing that comes to mind is engagement from the beginning, and one thing to avoid is to not do all your research and then, or your data collection, say, oh, I really think this would be great for this decision maker. Now I'm going to present it at the end. And they may be like, okay, I don't really care, honestly. So I think, I think that's one thing that we've learned is trying to understand what data is most important, what format is most important, and how to integrate or include engagement throughout that.
I think this is a good question. And in my own experience, I think being very choosy about the types of student projects, the types of grant opportunities, there's always opportunities, there's always doors opening, but carefully choosing what matches how you know your partners. So we're very lucky to have been working closely with Helvetis for so long that at this point, I think we really get each other at, the organizational level. And there are some grant calls that I just know the timeline is too rapid and it will never work. So saying no goes a long way for keeping the collaboration operating as it should.
I like that. Thank you. If you can introduce yourself and then let us know whether you have a general question or a specific one for Rachel or Sarah. Please.
Sure. Kellogg Schwab, Johns Hopkins University. It's really interesting. And one of the things that's fascinating about this is how to go to scale. And the ideas of this working in the team environment is so true. And Sarah resonated well with, those, oh, by the ways, or something that's going to stop it, but still moving forward. How do we take it and enable these data to be collected in areas that allow the joint monitoring program to get a better assessment at the regional level of the baseline acceptability of the information coming in? Because it's the individual kind of working with the team's important, but I'm struggling with how do we then modularize this and standardize it to go to scale to the outside communities, to the further ones away. And I'm going to pick on Sarah, but I think it's for both of them on there.
Yeah, we have not reached scale, but thank you to the REACH project. We went from a catalyst level project, which was 1 district, up to 5, which already is a big effort. What we've noticed, one really interesting effect of this project is, I think you would call it spillover, or positive spillover. So there's been some replication of the laboratories. We've just heard through kind of stories with our partners that other groups have taken up the same equipment, the same arrangement. I'm a big fan of this bottom-up approach, and I think it really is just that slow build of momentum maybe can eventually precipitate into something more institutional and formal, but we have not reached that yet.
Great. I'm also conscious, but
Sure. Thanks, Kellogg. I can speak specifically to the Water Quality Assurance Fund too that Aquia has implemented in Ghana, where I presented on our pilot of 10 systems. We're now expanding to 30 systems within Ghana and also to other countries under the USAID Real Water Program. And I also just wanted to mention that I think another piece of scaling up and thinking about data access is also thinking about what monitoring systems or what systems are already in place in the country in terms of national monitoring systems. What opportunities are there to integrate into those or build upon those? So that's really our next phase of work. Will include that piece as well. And actually, just last night over dinner, we had a great conversation about having a potential meeting initially with a lot of the stakeholders involved before we're designing that system or, thinking about the next step to really ensure that we have engagement to understand what are the data needs for the key stakeholders.
Great, thank you. 20 years ago, I held up my BlackBerry and I said, I got no clue on how I'm going to use it, but I'm going to use it in my research. And so 15 years ago, wow, I got a photo on my, capability on my phone. And now we've got this capability here of disseminating information, but also disinformation that across the world, there's more phones than toilets. And so I think one of the parts of that is that modularizing, figuring out pictorial, getting others involved in the same way that we sell items on this to work for WASH is something to consider as we go to scale. That's a pitch. Overall.
That's the discussion for coffee. Thanks. That also reminds me, there was actually a comment that came in from the online session, not quite talking about BlackBerries, but saying with space observation of resources, air, water, there is so much data becoming available. Maybe even that will lead us into being able to use that kind of data for planning and service provision. So I'm going to leave you with that thought. Thank you very much for joining us for this session. Thank you to all our presenters and to Angela, WHO, UNICEF, World Vision, and others who put this together. And enjoy the rest of your conference. Thanks very much.